So we focused on the implementation of the nutrition education program. And our first step would be to examine how nutrition curriculum is currently across all sectors. And number two was to do a needs assessment. So figure out what are the needs across the sectors. Develop questions to do key informant interviews and focus groups. So where there's not a large demographic, we'll just do a key informant interview. But maybe your staff, they're overwhelmed, maybe we'll just pull out a couple of leaders to talk to. Within the focus groups, one thing that we came up with is what are the language needs. When we start talking about nutrition education, we start talking about translation. So we want to make sure that that doesn't get lost. We want to make sure we have a question about what language should we be delivering the education. The people who do this program planning and development, everybody, all the sector managers are involved, the consultant dietitian, the program manager, and also ANSA. There's a lot of activities with program planning and development. We only started a few, which is talking about budgets for the program, budgets for translation if we're going to need to translate materials, budget for printing the materials, developing the curriculums, and developing a timeline for rolling out everything. And then program implementation was the next step, and that would be including the overall program for participants, but also curriculum training for the management staff. So people who are not directly involved should also still be receiving training on the nutrition program. Implementation-wise, we're talking about the community-based healthcare workers. So there's going to be 14 expert staff, and this would be their, one of their main responsibilities would be to roll out nutrition curriculum. Based healthcare workers are actually going to be the trainers. Okay. So they'll get, we have to still decide at what point are we going to bring them on board, because they're really not integrating into that role until September, but it might be that we have them come in June and get trained and then get refreshed in September. So that would be the community-based healthcare work. And then lastly, we have monitoring and evaluation, and really thinking about what can we do internally, what can we do externally, and what can we afford to do. So when we talked about the community-based healthcare workers, there's going to be 14 people who are home-based healthcare workers who are now going to community-based home care workers. And we have a very complex chart of who they're going to be training. But basically, the program manager is going to be consulting with the dietitians. That person, maybe along with the dietitians or maybe by themselves, is going to be training the community-based healthcare workers on training the trainer. They're also going to be doing the training for the sector managers. So that would include all the sector managers, and might include the Hoops for Help directors, all that. Community-based healthcare workers will be training the garden program managers, so there's going to be curriculum for that. They're going to be training the club assistants. They're going to train the MVPs and the program coordinators for Hoop for Hope. They're going to train the foot soldiers and the field staff for ECD. They're also going to train the field staff for FSS. Then, from each of those programs, so for example, for garden manager and cooks, they're going to, for coordinators, they're going to train all gardeners, and the cook and the chair and all the seniors. So things will trickle down. Right?
But the community-based healthcare workers will be the key group that will be trained to become trainers.
Okay. Sector managers and all the directors will also be trained as trainers, although that won't be their core responsibility. And an issue came up yesterday about what about sustainability and refreshers. It will be the community-based healthcare worker who's responsible for doing refreshers. And it might be that one community-based healthcare worker is always working with the senior sector. I mean,
yeah,
we haven't talked about that yet. But
we need to do that.
The indicators, when we talked about, is this program working? We want to look at number of participants, all the demographics of those participants, and then manage some way to look at, is there a change in knowledge? Is there a change in practice? So are people doing new things because of the training? So we